Page 1 of 158. Aapc Cpc Practice Exam and Final Exam. Study Guide with complete 480 questions and well-elaborated answers. Just released this year. Aapc Cpc Practice Exam. Question: a 70-year-old female who has a history of symptomatic ventral hernia was advised to undergo laparoscopic evaluation and repair. An incision was made in the epigastrium and dissection was carried down through the subcutaneous tissue. 2 5 mm trocars were placed, one in the left upper quadrant and one in the left lower quadrant, and the laparoscope was inserted. Dissection was carried down to the area of the hernia where a small defect was clearly visualized. There was some momentum which was adhered to the hernia, and this was delivered back into the peritoneal cavity. The mesh was tacked on to cover the defect. What procedure codes are reported? A. 49,560, 49,568. B. 49,652. C. 49,653. D. 49,652, 49,568. Correct answer A, B. 49,652. Question: the patient is a 50-year-old gentleman who presented to the emergency room with signs and symptoms of acute appendicitis with possible rupture. He has been brought to the operating room. An infraumbilical incision was made, which a 5 mm versus step ascent trocar was inserted. A 5 mm 0 degree laparoscope was introduced. A second 5 mm trocar was placed suprapubically and a 12 mm trocar in the left lower quadrant. A window was made in the mesoappendix using blunt dissection with no rupture. 1/4. Page 2 of 158. Noted: the base of the appendix was then divided and placed into an endo catch bag, and the 12 mm defect was brought out. Select the appropriate code for this procedure. A. 44,970. B. 44,950. C. 44,960. D. 44,979. Correct answer A. 44,970. Question: a 45-year-old male is going to donate his kidney to his son. Operating ports were placed in standard position and the scope was inserted. Dissection of the renal artery and vein was performed. Isolating the kidney. The kidney was suspended only by the renal artery and vein as well as the ureter. A. Stapler was used to divide the vein just above the aorta and 3 clips across the ureter, extracting the kidney. This was placed on ice and sent to the recipient room. The correct CPTA with circumflex code is A. 50,543. B. 50,547. C. 50,300. D. 50,320. Correct answer A, B. 50,547. Question: a 67-year-old female having urinary incontinence with intrinsic sphincter deficiency is having a cystoscopy performed with a placement of a sling. An incision was made over the mid-urethra, dissected laterally to urethropelvic ligament. Cystoscopy revealed no penetration of the bladder. The edges of the sling were weaved around the junction of the urethra and brought up to the suprapubic incision. A hemostat was then placed between the sling and the urethra, ensuring no tension. What CPTA with circumflex codes IS are reported? A. 57,288. 2/4. Page 3 of 158. B. 57,287. C. 57288. 52,000-51. D. 51,992. 52,000-51. Correct answer A. 57,288. Question: a 46-year-old female had a previous biopsy that indicated positive malignant margins anteriorly on the right side of her neck. A 0.5 centimeters margin was drawn out and a 15-blade scalpel was used. for full excision of an 8 centimeters lesion. Layered closure was performed after the removal. The specimen was sent for permanent histopathologic examination. What is CPTA with circumflex codes for this procedure? A. 11,626. B. 11626 1200 4-51. C. 11626 120 4-51. D. 11626 131 32-51 13133. Correct answer heavy check mark C. 11626 1204 4-51. Question. A 30-year-old female is having 15 SQCM debridement performed on an infected ulcer with eschar on the right foot. Using sharp dissection, the ulcer was debrided all the way down to the bone of the foot. The bone had to be minimally trimmed because of a sharp point at the end of the metatarsal. After debriding the area, there was minimal bleeding because of very poor circulation of the foot. It seems that the toes next to the ulcer may have some involvement, and cultures were taken. The area was dressed with sterile saline and dressings and then wrapped. What CPTA with circumflex code should be reported? A. 11,043. B. 11,012. C. 11,044. 3/4. Page 4 of 158. D. 11,042. Correct answer AEC. 11,044. Question. A 64-year-old female who has multiple sclerosis fell from her walker and landed on a glass table. She lacerated her forehead, cheek, and chin, and the total length of these lacerations was 6 centimeters. Her right arm and left leg had deep cuts measuring 5 centimeters on each extremity. Her right hand and right foot had a total of 3 centimeters lacerations. The ED physician repaired the lacerations as follows. The forehead, cheek, and chin had debridement and cleaning of glass debris, with the lacerations being closed with on E layer. Closure, 6-0 proline sutures. The arm and leg were repaired by layered closure, 6-0 vicryl subcutaneous. Sutures and proline sutures on the skin. The hand and foot were closed with adhesive strips. Select the appropriate procedure codes for this visit. A. 9928 3-25 12014 1203 4-59 1200 2-59 11042-51. B. 9928 3-25 12053 1203 4-59 1200 2-59. C. 9928 3-25 12014 1203 4-59 11042-51. D. 9928 3-25 12053 1203 4-59. Correct answer heavy check mark D. 9928 3-25 12053 1203 4-59. Question. A 52-year-old female has a mass growing on her right flank for several years. It has finally gotten significantly larger and is beginning to bother her. She is brought to the operating room for definitive excision. An incision was made directly overlying the mass. The mass was down into the subcutaneous tissue, and the surgeon encountered a well-encapsulated lipoma approximately 4 centimeters. This was excised primarily bluntly with a few attachments divided with electrocautery. What CPT and ICD-10 CM codes are reported? A. 21932 D17.39. B. 21935 D17.1. C. 21931 D17.1. D. 21925 D17.9. Correct answer heavy check mark C. 21931 D17.1 powered by TCPDF, www.tcpdf.org/4.